Interestingly, women are born with all of the eggs in their ovaries that they are going to have for their lifetime, and many women do not realize that. We begin to see a decline in women's fertility around the age of 30, because at that point, the woman has already been losing many of her eggs from the time actually that she was in her mother's uterus. Again, a fact that most women are unaware of. Each month, many of those eggs die off. So the thought would be for many couples, well, I'm using a birth control pill, so I'm not ovulating, so I must be protecting my eggs. But in fact, even without ovulation, the eggs each month are dying off. And each month that a woman ovulates, she might think, well, I'm losing one egg and I have millions. But the truth is that not just the one egg that is released dies, but many other eggs begin to develop and die off in that month. So that by the time that a woman reaches the age of 35, a significant proportion of her eggs are gone. And for this reason, with time, the amount of eggs, the number of eggs per month that decline or that die off will increase, and the quality of the remaining eggs are not the same as those eggs that ovulated many years prior. What's important for women in their late 30s and beyond is to be knowledgeable about the biologic clock, to understand that once they're in the position to become pregnant, that they should be proactive. They should be as healthy as possible in terms of making sure that their weight is in a healthy range, making sure that they have been diagnosed and treated for health disorders such as high blood pressure and diabetes, making sure that they're not smoking, and also being proactive in terms of seeing their OBGYN and then asking to be seen by a fertility specialist if appropriate if they're not getting pregnant in a reasonable amount of time. The current recommendation is that for women who are over the age of 35, who have been without contraception for more than 6 months, that they should begin their evaluation and begin discussing treatment options. It's very important that we begin educating women at a relatively young age so that they can be proactive and make choices rather than have the choices made for them. It's always difficult when couples come in and a woman is perhaps age 40 and really did not understand that her fertility was declining over time. In some instances, the right person does not come into our lives at the optimal time, but in many other instances, there are couples who wait because they feel that time is on their side, they're healthy, they have a healthy lifestyle. Why shouldn't they be able to wait? So when we're looking at educating young women, it's important for them to know the facts. And it's important for them to know the facts so that they can make the appropriate decisions. We want to understand our own fertility and understand that if we have to wait because of life circumstances, at the very least that when the time comes to become pregnant, that they see their obstetrician gynecologist, be informed, find out what their options are, and then if they're trying to become pregnant and are not successful, to be referred to a reproductive endocrine and fertility specialist for more involved treatments or higher levels of treatments. The future for fertility options for women is better than ever in the past. We have so many new techniques and technologies to offer couples so that really there is no reason for a couple to despair, even if they've been told that their fertility is compromised at this particular point in their lives. Currently, there are emerging technologies such as freezing the eggs, what we call oocyte cryopreservation. Although still considered experimental, being performed in many practices throughout the country, and it may help women to slightly rob the biologic clock if they are in a position where they are not ready to become pregnant and recognize that there may be a period of time after the age of 35 where they will not be able to get pregnant. They may elect to have eggs removed and frozen or cryopreserved so that in the future, when they are ready to become pregnant, those eggs can be utilized as they will be frozen in time and be equivalent to the age in which they were removed. So that's a very exciting technology that is actually being practiced in many places throughout the country, but is still considered somewhat experimental. Ultimately, pregnancy rates through in vitro fertilization have increased significantly. Our chances of helping couples over the age of 35 to become pregnant and achieve their dream of becoming parents is better than ever before. For those couples who may not be able to utilize their own eggs, donor egg and even donor embryo are technologies that are available as well, so that hopefully all couples who are trying to achieve a pregnancy will be successful